This comes directly from the actual government. They did this research within there. And if you can scroll down, continue, keep going.
What am I looking for?
Right there. So where it says resource of health insurance private. So the vast majority of population, about 47%, is covered by private health insurance. Those under 65 and their dependents obtain private insurance, whether it is through the employers or by the individual. This is with or without VA insurance. So VA is not necessarily an insurance program. It is an insurance system. It's a healthcare system. So what I mean by that is, go ahead.
No, you just kicked right into the question that I was going to ask.
Okay.
So please do continue.
Yeah. So a healthcare system is where it is paid for federally, like Medicare, right? It's paid for federally. The doctors are paid federally. And then the difference between health insurance is it is a contract between either the employer or the individual with that specific carrier as a promissory note to be able to provide the particular information within the plan. Because there is no particular information within the VA system, it does not and has the ability to deny any and all coverage that you might be able to seek. So being able, yeah, it can deny you for anything.
Fuck straight off.
Again, I've heard that hundreds of times.
Yeah.
And they did that a lot after Vietnam with the Agent Orange.
Exactly.
Yeah, I got an uncle that
they did.
Yeah, they're like, you're fine, fuck off, And it wasn't until almost 2 decades later, when they actually, oh no, Agent Orange really was a carcinogenic, and they have a whole, mass grave of guys who passed away from it already. A lot of
I lost an uncle with that.
Yeah. So if you actually look within the VA system, there are certain parameters within their disability area of those that have been that have come in contact with Agent Orange, or those that were in NOM prior to 68, and how the warfare affected those individuals, and they're able to have a particular amount of disability because of those things. So if we look at this figure, 61% are through employer group insurance. But if you're talking about VA, a lot of times, and I have several corporate clients where they say, oh no, they have VA, they're good. And I said, are you willing to sign a waiver on their behalf if you don't want them to come in and have that conversation? Oh no. Great, because they're entitled to this.
Ruh-roh.
Oh, there we go.
Right.
Now, say that again for the kids in the back of the class.
That's a 3-snapper right there.
It is. So if you are working somewhere and you have VA benefits, you are still able to have employer or group insurance. And that, honestly, that's the best way to go. 95%
really useful
of the time, the employer pays anywhere between 40 to 70% of that insurance bill. So you don't have to come out of pocket anywhere between, $700 to more if you're adding children and a spouse.
Over the past decade when I've talked to guys, some of them actually were able to negotiate higher pay because they weren't taking company medical benefits. They were on VA.
Correct. That is
Yep.
also something that I have sat down with those individuals and said, hey, so since you're not costing the company anything, have you thought about?
So right here, I can say that I know an office of attorneys, Tracy's attorneys, Pop, that could use this as professional development material, and that would be a billable item.
It absolutely would be.
They need to hear what you just said, because I've heard this stuff before. And no, you can't mix and match the two and this, that, and the other. And obviously you just said, yes, you can have VA and you can have insurance. If you're interested, I will ask those attorneys if they would like a professional development course.
I'm happy to help wherever I can help. They don't need to pay a fee. I'm just happy to help wherever I can help.
Charge them. They're attorneys. That's what they're for. Bill the attorney. You're supposed to bill them. My point being, we had clients come through who were veterans and in situations similar to this, and our attorneys knew nothing. I know nothing about it. Had I known, I would have told my attorney, no, you need to do this.
Right, because as a VA, you're only told, great, you have these VA benefits because you've come out of this system where everything was taken care of. You needed to see a doctor while you were enlisted. Great, it was applicable. You needed to have some sort of blood pressure medication. It was applicable. You had all of these different things that you had access to while you were enlisted. And the moment that you're enlisted, it's kind of like a kick in the ass that says, all right, see you later. Good luck with that. We're not going to tell you any information.
That's pretty much how it goes. Yeah.
Yeah.
For those not in the know, I'm a private paralegal, which is why I know this stuff. So anyway, carry on.
So when we look at this, right, we have this employer group, 61%, non-group insurance, which means that people who are seeking individual insurance for them or their family, 13%. Medicare is also that 13%, but something that they did not take into account within this graph is those that have VA and Medicare. So the only way that VA will benefit you within any Medicare information is if you have a Medicare Advantage policy. Within that, you have covered vision, dental, hearing. You have some fitness related benefits where if you have original, you're on the bill for everything.
What is original in this context?
Sure. So original Medicare is Medicare A, which you're entitled to as a citizen. Medicare B, which you earn by working at least 10 quarters out of your lifespan before you are eligible for it.
Wait. How does one work 10 quarters, being that there are only 4 quarters in a whole?
You're right.
2.5 years.
Right. So it calculates that you need to work that many. So you basically need to work, 2.5 years?
2.5 years out of your entire goddamn lifespan.
Right. In order for you to have Medicare B. But still, with Medicare B, it comes out of your Social Security. And this year, they bumped it up by 11.6%. So it's $288 that you cannot get away from unless you are a veteran. Because the VA actually steps in and helps cover that information on that end.
Now, $288
monthly.
What's that? $208 monthly? Really?
Yeah.
Ooh, that's
right, and that's a lot
right there, man. Oof.
When you're only bringing in whatever, and let's say 2,600, and you're literally trying to survive within this economical range. That's a big cut. That's your groceries. That's your power bill. That's your phone.
Yeah.
That's your rent. That's your insurance on your car. Like it's a huge difference.
That's a huge number. When you're on a fixed income, that's a kick in the nuts.
Yeah, it is. And also, if you do not have credible coverage after 65, so you have 3 months to enroll in Medicare. You have the birth of your birth month, and then you have 3 months afterwards. If you don't enroll within that period, they're going to charge you 10% for the rest of the time. So that 10% is added to whatever is taken out.
Wow. That's some fucked up shit, man.
It is some fucked up shit. I completely agree with you.
I didn't even
Wow.
know.
That information there, can we get that on a sheet of paper or something? Because that would be really useful to put up.
Yeah.
I will send you my university information that I share, and I will give you the whole entire spread of explaining Medicare A, Medicare B,
holy balls,
descriptions of the drug program. Also, you will get penalized if you don't enroll in that in a specific time. So I will provide that to you so it can be at your access. Yeah. They're going to find you wherever they possibly can. But here's the thing. If you are on VA insurance or healthcare system, it is what's called a minimal essential coverage. So it literally covers the bare minimum within any health insurance, within any Medicare plans, within any Medicaid plans. Whether it costs you money out of your pocket or not, it is the bare minimum that you could have.
Watch Grunt Speak live every Tuesday and Thursday at 8 p.m. Eastern. And if you want to join Pop for Supporters Sundays, go to redonkulous.com/donate and make a monthly pledge. A link is in the Meat Gazer box.